Right. Just a quick disclaimer from the ARC. This is special education during COVID-19. The date is September 29th, 2020. We are presenting this through webinar with Ms. Tanya Alvarado. Just a quick view of our disclaimer. This presentation is provided for educational and informative purposes only. All right, Tanya, you can go ahead and share and begin your presentation. Thank you again. Look like you're on mute when you said thank you, so I just want to let you know.
Okay. Good evening, everyone. Thank you for joining us. I'm honored and excited to be here to talk to all of the parents, everyone who's participating in this section, and a special thank you to the ARC of Lehigh and Northampton County as well for hosting this presentation. My name is Tanya Alvarado. I am a special education law attorney. I have been practicing for close to 30 years now. Actually, it's been a couple of years since I started my own practice, but I continue to practice in the area of special education and representing families and children with special needs. One short disclaimer is that the information I'm providing you is for informational purposes only. It is not legal advice, and it is based on information that is current as of today, September 29th, 2020. And that disclaimer now more than ever is very important because we have vastly and continuously changing situations that are occurring with COVID-19, the pandemic, and and how it's affecting each school district, county, and each family as well. Okay, so the IDEA and Section 504 are the two federal statutes that provide rights to children with disabilities, students with disabilities. Neither of these statutes have been suspended, curtailed, or modified in any manner. And that's something I wanted to start with at the outset. The basis at which we're going to start provision of services or what's in the IEP or what your child's rights are the statute, the IDEA and Section 504. There have been some modifications temporarily due to the impact of COVID-19, but fundamentally, these statutes are unchanged and the timelines are also unchanged. So evaluations and reevaluations are to occur every 2 to 3 years, depending on your child's needs. IEP Section 504 plans are offered annually. They should not have expired. If they're expired, then your district is out of date with compliance, and you do need an annual program. Throughout the presentation, I'm going to have various slides. Some of them are going to be from the U.S. Department of Education. Others are going to be from the Pennsylvania Department of Education. And lastly, some of the slides are going to be tips for parents. My interpretation of the guidelines, how the guidelines affect the statutes and the parents' rights, but also strategic suggestions for the family members in terms of addressing these ever-changing issues that you are presented with in terms of online programming, in person, the hybrid programming. There are a lot of issues that have popped up, particularly this fall, regarding the provision of services for students with disabilities. So I've coded the slides differently so that you would know what is guidance, what's my interpretation, and I have slides for tips for families. So I'm hoping that you find these helpful in terms of dealing with some of the issues that you've been facing since the start of the school year. The U.S. Department of Education has indicated that these school districts must provide special education services that are appropriate. They must make every effort to provide those services, and they must ensure that they're provided to the greatest extent possible. These are very affirmative words that are being used by the U.S. Department of Education. So as I said before, the starting point is your child's IEP. Let's see how many services can be provided, and where there has to be some level of flexibility because of the pandemic, then those services need to be discussed and temporarily reformatted so that the delivery of services can continue to your child, even though it may not look the way we had initially considered when the IEP was being drafted. The U.S. Department of Education has also indicated that where the IEP or Section 504 cannot be fully implemented due to the pandemic, compensatory services may be owed to the family. I know there are a lot of questions regarding compensatory services, how they're calculated, how they can be delivered, and when. I have a lot of slides relating to that particular issue, more towards the end of the presentation. So we will be addressing those, and if you have any questions, please send them in. We had some questions sent in before the presentation, which I have here, and I'll try to answer as we go through. There's a lot of information to go through. So what I will do is certain aspects of the presentation I'm going to run through fairly quickly because I want to get to the meat of the issues that we are going to discuss today. But before we get there, I want to provide some background information in terms of what the current guidance is regarding the impact of the pandemic on the educational services that your child is supposed to receive this fall and this school year, continuing until we go back to, you know, our normal, in quotes, delivery of services. So the Pennsylvania Department of Education has issued over the summer, July, August, and a little bit more recently, I did find some guidance in September regarding how these services may be impacted during the pandemic. It's important to remember that the guidance is not law. It is not a statute. It is guidance. It's a starting point for districts and families to consider how the provision of special education services will be managed during this time frame. The days or hours of instruction for this school year has not changed. So we're looking at 180 days, 900 hours for elementary school students, and 990 hours for secondary students, unless the school board of your particular district has applied for a variation of those requirements. The other issue regarding the guidance is that the school districts can issue NORAPs for temporary changes due to the pandemics. We'll talk about NORAPs also towards the end of the presentation regarding temporary NORAPs. How can we distinguish between a temporary change to the IEP and something that's going to look more permanent, and which is an important distinction because you don't want your child to lose services they're entitled to in their IEP simply because we have a temporary situation that's affecting the delivery of services. The U.S. Department of Education has identified 3 instructional models for delivery of services: full in-person instruction, blended or hybrid instruction, and full virtual instruction. And there are different standards connected to each one. If you go to the Pennsylvania Department of Education website, and I have the link here on this slide right in the middle of the page, the type of instructional model that your school district is permitted to select depends on the level of COVID incidence in your county. That level of incidence could be incidence per 100,000 residents or the percentage of the positivity rate in the county. So you can look at either number, but depending on what those numbers are, that is a starting point in terms of what type of services, whether full in-person, a blended or hybrid service, or a full remote service is offered to your children. If you're in a low incidence county, that's less than 10 cases per 100,000 residents, or less than 5% of the positivity rate, you're permitted to do full in-person or a blended hybrid program. So if you're in a low incidence county, you can still choose to do full in-persons 5 days a week, everyone's in the building, or a blended partly hybrid, partly in the building model. If you're at a moderate rate, a moderate incidence rate, you can choose, or the district can choose between a blended or full remote. Many of the school districts are in those two categories. And I did look at the link provided here on your slide to see what the incidences are with respect to every county in Pennsylvania, and they're all itemized there alphabetically. You could see what the incidence rates and the percentage of the positivity rates are. I did find most schools are in the low to moderate, which means that they can choose either full in-person or blended or full remote, again, depending on where the schools fall. A substantial incidence rate, if your school district is in a county that has a substantial incidence, the only option they have is full remote. That is the only category that I found with the Pennsylvania guidelines where a school district can say, we are full remote, there's no blending or hybrid program, no one's going in the building. So those levels, those instructional models are going to be important because they do impact some of the suggestions I have in terms of whether you can get 4-day instruction in the school building, or whether certain services should be provided to your student online or in the building and things like that. So some of these definitions are going to come into play a little later in relation to the services provided to your children through their IEP. This notification is updated every 7 days by the Department of Health. So, and I have the link there at the bottom of the page. So one of the reasons I'm providing this to you is that because we don't know what course the pandemic is going to take, your school can move throughout the school year from a low incidence to moderate or even substantial, depending on how things go. The bottom link to the Department of Health will help you keep you abreast of the development of the incidences of COVID-19 in your county, so that you're not caught by surprise if your district goes from a moderate to substantial, or vice versa. The full in-person may be 5 days a week in person or less. Remember, they have an option between full in-person or a blended model. I'm finding, based on my interactions with my clients and what I've seen, most districts are choosing a blended model. There's only 2 districts in Pennsylvania who are in the low incidence counties, and my understanding is that they're providing a hybrid model. Under the full in-person, some staff and students may still be in a remote setting, and it's still subject to the CDC and Department of Health guidelines, meaning this isn't, a situation where COVID doesn't exist. What it means is that you can go in 5 days a week, but you still have to maintain the health and safety requirements set by the CDC and the Department of Health, meaning 25 persons max indoors, 250 in outdoor gatherings, and the other safety measures that we're going to go through with the slides. So this doesn't necessarily, even if your county's in the green, it doesn't mean that the COVID doesn't exist. It just means that the restrictions are the fewest. In the blended or hybrid model, these again are the low incidence and the moderate incidence states, counties. It can be any model with 4 or fewer days of in-person instruction. So it could be 2 days a week in person, 3 days a week at home. Some districts are switching between 3 days a week, 1 week, 2 days a week, the next week, the rest of the time is online. Again, school districts are required to maintain social distancing and other health preventative measures. And I have some examples here of the types of instruction models that I've seen: split schedules, rotating schedules, scaffolded approaches that treat the grade levels differently. So, you know, some kids are coming in the morning, going home in the afternoon, and vice versa. The full remote or virtual model is any model which all students are all learning remotely due to the incidence of COVID in your county. There are some school districts who in the beginning of the fall have opted to provide virtual instruction for all of the students. And they don't have the hybrid model going in. Now remember, districts in the low and moderate incidence can choose that. They have choices, but it doesn't mean that they must choose it. School districts or in counties that are at a substantial incidence rate are required to only provide full or virtual instruction. I don't recall seeing any counties that are in that substantial incidence rate in my last check with the Department of Health. Okay, so we're gonna run through some vocabulary now. The tips for parents are my slides where I provide some suggestions and my interpretations of the guidelines and how they may apply to parents. Synchronous versus asynchronous. I'm not going to spend too much time on this because this instruction has already started, and I think a lot of families are already familiar with these terms. Synchronous means you're watching a live feed of a teacher instructing in real time. You can ask questions, you can raise your hand. There's some interaction, not a lot because teachers have to get through their curriculum, but the teacher's there and it's happening in real time. Asynchronous instruction is generally a pre-recorded lecture. The communication during the instruction period could be through email, since the teacher is not teaching live as you're watching it. You can send questions through email. You can have an online chat maybe with a teacher if a teacher is available at that time. There's little to no live access to a teacher during the instruction. Okay, so virtual versus cyber school. I had a lot of parents ask me these questions, and I think some of the questions that we have one question that came in before the this presentation about a student whose goals were suspended because a parent is choosing virtual instruction, and we're going to get to that in just a bit, but this slide would be helpful. Okay, virtual instruction is instruction that has been impacted through COVID. It describes the temporary situation where the school district has chosen to either provide online instruction full-time or as part of a hybrid model. And largely the instruction is synchronous. The teacher is teaching as the child is engaging with the instruction. Some school districts, whether or not there's a pandemic, have also offered cyber school at the district. This is something that has existed way before COVID-19 reached our borders. And cyber charter schools, as you know, typically provide cyber instruction via cyber online instruction. Those designations are different than the virtual instruction that is temporary for COVID. So the reason this is relevant is that sometimes if a school is providing either a blended model of instruction where the students are going into the school building for a couple of days during the week, and the parent may be concerned about that for various reasons, the school district might say, well, we have cyber school available. You don't have to come in at all, and you can sign up for that, and and that's it. I do want to emphasize that that is not the same as the COVID virtual instruction that the school districts are permitted to provide. So the cyber school instruction is not temporary. It is a choice you're making for the entire school year, whether or not we return to the school buildings full time, get the pandemic under control. You're in it for the entire school year, largely because the curriculum is going to proceed at a different pace than the virtual hybrid instruction that you're receiving. So if you're choosing cyber school because your child, for various reasons, cannot go into the school building, you should be aware that that is a decision you're making for the entire school year. It does not guarantee access to online services or live services from a teacher. If your child has an IEP and you choose a cyber school or a cyber charter school as your mode of instruction, children with IEPs are still protected and they still are required to receive appropriate services. So you still have access to appropriate services, live teachers, if necessary, in order for you to understand the instruction that's being provided. But it's different. There's no live feed from a classroom, for instance. And the student doesn't get to see their friends even virtually on Zoom. It's a full-time online program. So those are some of the differences. At the bottom of the slide in red, I put in, it's very important. If your child cannot attend in-person instruction due to the COVID considerations, so if you're in a situation where the only reason you're considering full online instruction is because of the COVID pandemic and a medical need your child has, or a concern that your child cannot follow the safety procedures, don't automatically sign up for cyber school. There are things that you can do in order to address some of the issues and the concerns that you have before making a decision to have your child participate on online cyber school programming for the entire school year. It may be unnecessary. Okay, so I do want to, I'll run through the health and safety plans and then we'll get to the tips, IEP tips in terms of what you can do regarding your child's needs and the programming. The school districts are required to submit health and safety plans to the Pennsylvania Department of Education. They're required to be posted on the district website and in accessible format in different languages and sent to families in print if the family cannot access the online information. These health and safety plans are a guide to the family and information so you understand what the school district is doing and the types of services they plan to provide depending on what phase they're in, whether they're in green, yellow, or red. I'm going to run through some of these slides just because there's so many. The health and safety plans are pretty voluminous. The requirements are pretty specific. And but I am going to touch upon some of these a little bit more specifically. They're the ones that I put in italics. So you can see, through the slides, there identify a pandemic coordinator or a team, what steps they're taking to protect students and the staff who are at high risk for severe illness if they're exposed or become ill to the COVID-19. The process for monitoring students and staff for symptoms, quarantine measures, guidelines for hygiene, and face coverings for students and staff. And we're going to spend some time on masks. Posting of signs in the school regarding hygiene and safety measures, procedures for cleaning and sanitizing the building and the materials, social distancing in the classroom and throughout the building, meal service, sports, staff training. As you can see, it goes through a lot of information in terms of what the school district is supposed to do, or with respect to each of these issues. Limitations on number of students, limits on sharing materials, identifying, restricting non-essential visitors and volunteers. It's something we're going to go into. Transportation should be italicized. We're going to talk about that. And a system for ongoing communication with the families. Largely, a lot of the advice that the school districts are receiving regarding some of these measures are from the CDC, the Centers for Disease Control and Prevention. We're going to take a look at some of those right now. For students who may be at increased risk of having a severe illness or becoming or contracting the COVID-19. So those are students who may be at increased risk. So the first slide is about students who are at increased risk of experiencing a severe illness as a result to contracting COVID-19. CDC has identified, this is not an exhaustive list, but it's a suggested list of conditions that you may want to consider for identifying students who may be at an increased risk. So students who have chronic lung disease, like asthma, it could be COPD, whether the student has a chronic lung disease, there's no identification of specific diagnoses that, indicate, yes, that's a chronic lung disease, the other one isn't. But if your child has difficulty with the respiratory system, I would suggest, and you're concerned about exposure to COVID-19, I would suggest you talk to your doctor, look into it. If it's a chronic lung disease, it may be, your child may be a child who is at an increased risk. Serious heart conditions, diabetes, a weakened immune system, and that could arise from any number of other needs that your child may have, but these are things to look at. Your child may also be at an increased risk of becoming infected or having an unrecognized illness. So if your child has any one of these situations occurring, they may be at an increased risk of becoming infected. And these children are also considered children at increased risk. So if your child has limited mobility, meaning they can't move away from someone who's not respecting the social distancing guidelines, or someone's coming too close, or their mask has fallen and they can't raise it, that is something that should be considered. If they cannot avoid coming into close contact with others who may be infected, they may be a student who's at an increased risk. So for instance, students who receive hand-over-hand assistance, obviously the staff that's working with the student has to also maintain safety protocols, but that might be a child who could be considered to be at increased risk depending on the circumstances. So none of this is a definite, my child has trouble understanding information, they are at increased risk. A lot of these categories require more information, and you need to kind of flesh it out why your child who has trouble understanding information is at an increased risk. They may not be able to understand verbal direction regarding hand washing or social distancing, or walking only in one direction in a hallway. If they have difficulty practicing preventative measures like hand washing and social distancing, it may relate to some students who have autism, maybe ADD, who have some ODD, oppositional defiant disorder. They may have language processing issues or visual processing issues, but it's a difficulty in participating in the preventive measures to the extent that places the child at an increased risk of becoming infected. And all of those things are going to be looked at very, very closely. And a child who may not be able to communicate the symptoms of illness. We have some children who, for instance, may be nonverbal, who are not feeling well but can't communicate that. So those are all the children in that category. The Department of Education has also identified social distancing and preventative measures that the school districts are supposed to take. Keep the students with cohorts, don't share classrooms, don't have students moving from one classroom to another throughout the day, staggered schedules. Many of you may be seeing some of these techniques implemented at your particular schools. Limit gatherings, hold classes in the gyms, the auditoriums, or other large spaces. These are all suggestions from the Department of Education, and I wanted to share them with you because it may be helpful for you to have them as parents when you're discussing the IEP and some modifications or changes that could be made in order to accommodate your child. Isn't it nice to know that the Department of Education is recommending that the school district hold classes in the gyms or auditorium? If social distancing cannot be accomplished in your child's classroom, perhaps you'd like to consider moving the classroom or that particular instruction to a larger setting in the school district. Their Guidelines again regarding meal preparation, serving meals, limit number of students in the hallway, create one-way traffic patterns in the hallway, separating students, and the list goes on. They also have some pretty specific ways of cleaning and disinfecting the materials and classrooms, which you can access on the PDE website. It's a link to the CDC as well, but that information is there. So how do we protect students who are at high risk for severe illness? Ask them to limit non-essential travel. Additional considerations and supports are to be provided to students with disabilities with complex medical needs to ensure their safety. So students who are at a higher risk for severe illness. So these are the students who have the heart condition, the respiratory condition. They were that first slide. Additional considerations and supports. The Department of Education is saying you have to consider additional considerations and supports for these students in order to accommodate this need. The district cannot simply say, well, if you can't come in, then just sign up for cyber school and, sign a waiver of services agreement, which I'll get into in a minute. They can't say that. You should have an IEP meeting to discuss what other methods the district can use to deliver these services without having to give up any compensatory education or your right to an appropriate education. For parents who are afraid of sending their child to school, these are children who are at a high risk from exposure or getting an infection. In terms of addressing this issue, what I would suggest is don't automatically jump to the idea that your child will be home online all the time. Of course, this depends on the circumstances, but one thing to discuss with the IEP team is whether the child can still access the services in the least restrictive environment. Either in person or in-school instruction is preferred. It's a preferred setting. It addresses a lot of issues, social skills. It allows your child to become more independent. Children who are in-person learning are receiving more benefit from their services provided in the classroom than, particularly children who may not be doing well with online services. So please consider the least restrictive environment. You may have to be very creative about it, but that's something to consider. Learn the specific measures taken by your school. Sometimes parents are afraid of sending their children in because they don't understand everything that the school district is doing to keep everything safe and clean. So have that discussion with your teacher and the IEP team. Educate yourself in terms of what the school district is doing. If you feel that regardless of what the school district is doing and all the preventative measures you're taking, that your child is still at a high risk from exposure, you can try getting a letter from a doctor documenting your child's needs and specific safety measures that may be taken. And that's something, of course, that depends on how much the doctor wants to put in there, but it is something, it's worth a discussion with your child's physician. And a letter from the doctor would be very helpful. And ask for an IEP meeting to discuss these additional considerations and supports. Here are some suggestions of some things that could be implemented. Flexible attendance policy. So if you're worried about your child arriving to school at the same time with large masses of students, maybe an early arrival time before the other students arrive could be agreed upon, or a later departure at the end of the day so that student isn't exposed to a lot of other students. The classroom, attend the classroom in the morning only. Some school districts are disinfecting the classroom at the end of the day, so the students who come in first thing in the morning come into a clean environment. So you may want to consider having your child attend in the morning and then maybe finish the day online. You may want to discuss adding some services to the IEP. If your child is worried about exposure in school, they have levels of anxiety or school refusals, just, you can get related services added to the IEP where they can meet with the counselor, the school counselor, and talk about it and work through that. For students who have difficulty remembering the safety and precaution measures, washing their hands, and all of that, you can add to the SDIs, the specifically designed instruction and progress monitoring. It's a section at the end of the IEP. Reminders, prompting, and a token system, if that's what your child could benefit from in order to participate in the safety measures and hand washing and wearing of masks and all the other preventative measures that are being recommended. If your child has a disability where you think a positive behavior support plan would be more appropriate. So the reminders and the prompting and the token system may not be sufficient. Your child may need a behavior plan in order to address these issues. That is something that should be discussed. Or a classroom aid to assist with compliance with health and safety measures. That would be added to related services and the SDIs and progress monitoring, the last section of the IEP. And this section is not discussing a one-on-one aid in the classroom, although one might be necessary. All of these changes are highly individualized, and sometimes an additional aid in the classroom is sufficient to prompt and remind your child to take safety precautions, not share materials. Some kids are very impulsive, some children are very young, but a classroom aid may be sufficient to keep your child in the school. So those are some of the things that should be discussed and explored with the IEP team. Instruction outdoors, instruction or therapy in a designated room in the building. So that's where we're talking about, maybe the cafeteria or the gym would be a more appropriate setting for the delivery of instruction. If your child gets learning support services or speech and language therapy, occupational therapy, that, if your child is at high risk, then perhaps getting those services with the OT and no other children in the room may be appropriate for temporarily for what we're facing with the pandemic, if it keeps a child in the least restrictive environment. And that's something you always want to fall back to. If you're discussing any changes in the IEP with the school district, think about the least restrictive environment. If you're asking for any of these revisions or temporary changes to the IEP, that's something, it's a word you may want to throw out there. And online synchronous instruction during in-person instruction. I added that in there because, again, I've heard from some of my clients and some parents that school districts are saying, well, we're providing in-person instruction. You're welcome to come and benefit from it. But if you don't, there's cyber school. You can go online for the entire school year. You can just do that and sign this waiver agreement, which I'll get to, I promise. But you don't have to do that. If there is instruction going on in the school building with your child's class, but your child cannot attend because they're at high risk, consider online synchronous instruction. Get a live feed in there. A lot of school districts are doing it on their off days when they're providing online instruction. It's something that is well worth discussing with the IEP team. Okay, we're going to take a little break to answer some questions. So I'm going to ask Jessica.
Sure. So we did have a few questions submitted early on when you were talking about the instructional models. So I'm just going to bring those up. So in that section, you discussed that the prevalence of the virus can determine whether or not a school would be hybrid, virtual, combination of both, or allowing 5 days in-person instruction. One of our first questions is if you are in a low incident per county, right? So you have a low amount of the COVID-19 virus showing within your county, can a district still continue to only offer virtual or hybrid and not in person?
Yes, they can. They can do hybrid. They do not have the choice based on the PDE documents, the guidelines. They do not have a choice of offering full-time virtual, well, I guess for the entire school year. They can choose full-time virtual They have all the choices. Yeah. So if it's a low incidence, they have all of the choices. They can do full-time in person, the hybrid, or full-time virtual.
Okay, great. So then the second part to that question is, let's say this school district in a low incident county does give the options of going on via their online cyber program via the district or hybrid. They do not offer an in-person option. However, that's what the family would like for their child. What is the recourse to doing or getting that type of in-person instruction, if any?
So you're in a low incidence county?
Correct.
Double check the, that county map that I provided. But if the school district is only offering online, I'm going to call it virtual instruction.
Okay.
The question is whether the student can nevertheless get in-person instruction.
Right, even if that wasn't offered by the district, can they request it?
Yes, absolutely. Remember, the choice of whether to do full-time virtual instruction is the school district's choice. It's an option that they have selected. It's not mandatory. We're not talking about March 2020 when the governor closed all the school buildings and they remain closed through June. So the low incidence counties provide the school districts an option. Now, the school district can choose to offer virtual services. That's fine, but do not confuse that with a situation where the governor has required that school buildings be closed. Those school buildings are technically still open. So yes, you can request in-person instruction in the school building if that's what you feel that your child needs in order to benefit from the instruction. I do have suggestions and some of the later slides that I have in terms of how to get in-person instruction for your child if that's what your child needs.
Great, thank you so much. And the second question on this same topic was when we are, we meaning a school district, when they are deciding on what types of instruction to offer, that is decided by the school board in their health and safety plan, correct?
Yes, that's correct.
Okay. All right. That was the only two questions that I had submitted during the live portion of this. Does anyone, while we're in this Q&A break, want to submit anything via the chat or Q&A option for Tanya to answer live on what she has discussed so far? Just give a few minutes for any of those to come through, and then if not, we'll continue on.
I did have one question. I'm just going to read it. My son's IEP was suspended, in quotes, has suspended some of his goals. The statement reads, the goal has been suspended due to the parent choice for remote learning instruction. This goal will be resumed when the student returns to brick and mortar school. And the SDIs also say in person only. The question is whether that's legal. So no, there could not be any blanket determination as to whether your child is required to come in person instruction or can only do online instruction. Every child's program has to be individualized. If the, I don't know why the IEP goal was suspended. It may be, I don't know, if the parent was concerned about the child receiving in-person instruction in school, I suggest you go through some of the procedures that I just discussed in the earlier slides. Talk to your child's doctor, find out what's happening in school, and go through the different methods by which in-person instruction might be delivered. It may be a situation where if the IEP team, including the parents, are creative, you may be able to find a middle ground for least restrictive measures. The school district should not be suspending any IEP goals. Staying at home should not be automatically designated as a parent choice simply because the school district is providing services in person. Again, these are individualized determinations. So conversations and a meeting really should be held to discuss why the student needs, remote learning and whether that concern can be addressed in some manner in a least restrictive setting. Okay, I'm going to continue with the presentation at this point. And I think it looks like we have a quick question maybe. Okay, our son is not able to learn with this remote synchronous approach. He's not able to do in person for health concerns. What other options do we have? We've been told cyber school is not appropriate for him due to his needs. Live instruction is not working. So that's going to be a situation where you're going to want to bring in some of his health professionals to discuss what his needs are, what the health concerns are, and and why the remote synchronous approach is not working. Your child you may be able to find a circumstance where the child can either go into the school building and in a designated area that is clean in order to receive the in-person instruction. There may be, if there are any CCS considerations or other considerations, see whether the school district would be willing to consider, paying for a tutor, or, in place of the compensatory services while your child is receiving instruction. It could be a situation where they need a live person during the synchronous approach in order to help your child access the education. Again, what you want to avoid is this extremist thinking, all or nothing considerations. It's either going to be remote or in person. There's a continuum of services that could be provided in between. And without understanding specifically what the health concerns are or what the school district's concerns are, I can't give any more specific recommendations, but it is something that you should explore a little bit further. Okay, so I am going to kind of pick it up a little bit here because I just saw the time. Okay, use of masks and shields. Just everyone should be using the masks. Face shields are not a substitute for masks, and they're not effective. They could be used in addition to the masks, but visiting adults, students, some students may be challenging for them to wear masks. Younger students and some students with special needs would fall into that category. Students can remove their face coverings during the day, either when they're eating, where it would be unsafe for them to wear the mask. If they need a break, they can take a 10-minute break if they can, be socially distanced from other students, and take the mask off, get the break, and then put it back on. If your child has a particular need that, requires that they not wear a mask, that's something that you want to discuss with the IEP team, and also discuss what alternatives can be put in place so that your child can continue to benefit from the education. The CDC has issued some guidance in terms of who should not wear a mask at all. Children younger than 2. Anyone who has trouble breathing or is unconscious should not wear masks. And anyone who is incapacitated or otherwise unable to remove the mask without assistance. And this may apply to some of students with mobility concerns. The CDC has indicated that they should not wear masks. It prevents a health hazard. It might be challenging for younger students, students with severe asthma or other breathing difficulty, and students with special educational or healthcare needs. And I've provided you a list of some of the special education or healthcare needs that could be considered as challenging for some of these students. Again, this isn't an extreme all or nothing approach. If your child falls into one of these categories, consider addressing it in their IEP team. Consider maybe a transition plan to have them increase their use of their mask throughout the day so that they can, practice healthy and safe measures. But these are some of the concerns that may pop up, and it would be good to have this information when you're discussing it with the IEP team, because these would be circumstances where your child's program does need to be modified in some manner to accommodate their need. Clear masks are also recommended by the CDC if your child has a reading disability, gets speech and language therapy, or is learning or relying on facial expressions and lip movement for their education. This would also impact students who are deaf or hard of hearing. If the clear masks are not available or not effective, the district has to find an effective alternate means of communicating and bringing the instruction to the student. So again, it's not an all or nothing approach. The district has to make an effort to provide instruction to the student. And these are some of the tips for parents that I have in terms of what can be done and what changes to the IEP can be put in place in order to address any difficulty that the student may have with masks, wearing masks, or face coverings. Okay, essential or non-essential visitors. Who's essential? Oh, who's non-essential? Really, volunteers in the classroom, I think, are not essential. Visitors, the district should not invite them in if they're non-essential. These could include also special visitors. Some, unfortunately, classrooms can't have a visiting author or visiting artist, or some of these really great programs that some school districts provide during the year have to be suspended for now until we can get, until they can be delivered in a safe manner. Okay, so do the parents still have the right to go into the child's classroom to observe the class? Yes. The IDEA and the Pennsylvania regulations provide the parent the right to go observe their child in the classroom. You can also have a visitor observe the child in the classroom if it's necessary to the delivery of services. So I did have one parent who asked to observe the child's classroom, and the district told them that they are a non-essential visitor and could not go in. I disagree with that position. These guidelines do not curtail or limit the rights that the parents have under the law, and they should not be applied in that manner. The parents do have a right to observe the child in the classroom, and protective measures could be taken. So those should be considered and explored by the district. Be prepared to explain why the visit is essential, because that is the criteria. I'm gonna silence my phone. Sorry, just a second. I apologize. Okay, I'm gonna continue to go through these slides. Communication systems with the family have to be effective and in a language that the student and the parent can understand and have access to. Timelines, as I said before, they're not suspended. The district has to comply with these timelines for evaluations and IEPs. There's a lot of questions around what happens regarding evaluations, initial evaluations that started before the pandemic hit and the schools were closed, and now when we're in, what could be an all virtual model or a hybrid model with the school districts. And reliance on the previous guidelines when the schools were closed is significant and informative. The school districts are to complete all aspects of the evaluation and reevaluation that do not require in-person testing. So that is could include the records review, input from parents, teachers, rating scales, academic levels. This is particularly important for students who are in a hybrid program. If your school district is offering a hybrid model of instruction and the students are in the building for part of the week, those students should be tested. There's no excuse for not continuing with the evaluations or completing the evaluations that were started last spring. The guidelines for the Pennsylvania Department of Education is giving the school districts a little bit of leeway in terms of completing these evaluations because of the school district closures. So what the Pennsylvania Department of Education is saying is you complete them as soon as possible. It specifically says the school district cannot restart a 60-day time frame. So that is not okay. They need to, they can request a reasonable extension from the parents. If you're able to provide them, agree to a reasonable extension, I suggest it, because you want to get that evaluation completed. 60 days is not a reasonable extension. That really falls back to restarting the 60-day time frame. So they're not allowed to give you a new permission to evaluate form. They cannot restart that time frame, but do discuss with the district how that time frame can be compressed and that evaluation completed. If it's an initial evaluation and it's delayed in the fall, what the Pennsylvania Department of Education has said is that they provide students, these districts should provide students with additional supports and services. They could look like Title I services or RTI interventions until that evaluation is complete. Does this comply with IDEA requirements for free and appropriate education? No. These support services are not special education services, but they're an additional support so that your child doesn't go without services until that evaluation is complete. These are the initial evaluations to identify students with who require special ed services. The 60-day time frame, if there's a delay, the districts are being allowed to correct that delay largely without owing compensatory education. The question is going to be, what is a reasonable delay? What can be considered reasonable? And what I would suggest is that you go back to that previous slide where I listed all of the things that the district could have done even while the schools were closed. And if any of those were not done, if you have already signed a evaluation, permission to evaluate form before the schools closed in March, then those processes should have taken effect. And really what should be left are things that can only be done in person. Can the LEA do virtual assessments? The answer is maybe. There's some difficulties with virtual testing. Some standardization measures and validation can be affected if you're trying to do online a type of assessment that should be conducted in person. So that's something to consider. But again, that should not forestall the entire evaluation report. Other aspects of that report can be completed. And keep that in mind when the school district is discussing any delays. Okay, so in terms of the types of delays, again, if you're in a county that has a substantial incidence and they're full 100% online, these timelines have not been suspended. So explore testing in a different location if the school building is not open, and also explore whether the district should pay for testing out with an outside evaluator. This is not a request for an independent evaluation. The school districts, if they don't have the personnel, this is on any given day when we don't have a pandemic, if the school district does not have the personnel to test the student within the 60-day time frame, they are permitted to contract with an outside evaluator. And we see that sometimes districts contract with the IU to perform some evaluations that they don't have the personnel to perform. I would explore asking the school district to do this. If you are in a situation where you're at either moderate or substantial incidence, or if you're in a low incidence county and the school district is telling you it's going to take another 3 months to complete the evaluation, that's something that you should consider doing. Remember, as I said before, if you're in a moderate or low incidence county, the school district is choosing between hybrid and maybe full remote instruction. It's a choice. It doesn't mean that the building itself is closed and locked down. So, so there is an opportunity to bring your child into the school building, even if they're full-time remote, in order to conduct this in-person evaluation. Classroom observations and FBA, what I would recommend you do just to complete the evaluations, you may want to consider if your district is providing online instruction and we don't know when the endpoint is and your child is not accessing that instruction, it may be worthwhile to do a classroom observation during the virtual instruction so that the evaluator can see how your child is behaving or not engaging with the instruction. And then, a behavior plan can be created, or changes to the IEP could be made if the school district is providing the virtual instruction. These would have to be done again, possibly, when you're back in school building full-time in-person instruction. If you're in a blended model and your child is having difficulty accessing information or their education while they're at home and online, I would ask the school district to conduct some observation time during the online setting in order for their IEP to be, for that to be addressed in the IEP. Okay, we are at about 8:10. I'm gonna continue to kind of move forward here. And this is just, a request that the district contract with an outside evaluator is not a request for an independent evaluation. And it's very important to draw that distinction. Independent evaluations can only be requested once the school district has finished their evaluation. It's based on their most recent evaluation report. If the school district does not finish that evaluation, then you can't ask for an independent evaluation. And you can't ask for one during the course of an outstanding evaluation. And that has some limitations as well. But I just want to draw that distinction. Asking the school district to contract with someone, you're not asking for an IEE. Okay. Video conferencing etiquette. If your child is on online instruction at all, please consider what the background is. You want to face the child maybe with their backs to the wall, and in a quiet room and a quiet area. This would allow your child, of course, access to the education, if you decrease the environmental noise or distractions, but it also would prevent the school district from, I guess, having access to whatever's going on at home that you may not want them to have access to, some privacy considerations and things like that. I did have a comment by someone that a child was actually suspended because the teacher saw during an online instruction, either the student or a sibling with a Nerf gun. They thought it was a real gun. They called the, police or, the authorities, and that child was suspended for 5 days. So that's something that, obviously we want to avoid, and I'm not going to get into whether that was okay or not, but it's something that I wanted to make you aware of. The Pennsylvania Department of Education has approved some virtual backgrounds. So, and I have the link here, please consider looking at these backgrounds and choosing one perhaps for your child so that when they're engaging in live instruction, synchronous instruction, or even asynchronous instruction, they can put on the virtual background and you'll have some privacy protections for yourself and your family. They're really cute, so I suggest you take a look at it. Okay, if your child is having difficulty accessing online instruction, I suggest you keep a journal of difficulties. Call it a diary, a journal of difficulties. That is something where you want to note the dates for every entry, your difficulty with technology, your child's difficulty accessing the education, any attentional issues, anything that you write in your journal, you should also separately communicate in writing to your teacher so that they're aware that you're having some difficulties. But if you keep a log or a journal of this during online instruction, and this would also include during, the last spring and, into the end of the school year when we were online completely, that's something that you can refer back to when you're discussing compensatory services, due to the pandemic. Does your child spend hours trying to complete assignments? Write down how many. If they need repeated explanations, if you're constantly getting them back, their attention back, if they don't cooperate with instruction or homework, write it all down. This is all information that is very helpful. It could help with determination of compensatory services, but it's also extremely helpful for addressing their issues in the IEP and their access to instruction. If you're going to ask for in-person instruction, it would be really helpful to have that information as well, especially if you're writing down the dates, the amount of time your child is not attending, or whatever difficulties they're having. That would be very, very important. Again, communicate those by email to the teacher. You want to have that documented as well, because you would may need to show that you've alerted the school district of these issues and they weren't appropriately addressed, or they try to address them and they still don't work. Support your child during their schoolwork and homework, but do not correct their homework. It is so important to let them hand in the type of work that they're capable of performing. If you help correct their work before it's submitted, then that's going to mask or hide your child's difficulties. The teachers are going to think they're doing fabulously at home with online instruction. That's going to affect your ability to get more services in the IEP and can also affect the compensatory services. So please, it's very important, don't correct your child's work while you're supporting them. Okay, the IEPs, we're going to kind of go through these slides somewhat quickly as well. But again, none of your rights have been suspended. The IEP services may need to be modified or delivered in a different manner, but you're still entitled to services. And it just, it's frustrating to hear from families that the school districts are, telling them to, choose, parent choice for remote cyber learning because their, in-person instruction during the pandemic isn't something that their child can participate in. Or some parents are being handed waiver agreements when, it's a similar situation. It's just, well, we have in-person instruction. I'm sorry, your child can't participate in it. But if you're choosing not to, or if you're deciding not to, I shouldn't say choosing, if because we're not giving you any other choices, you have to go on cyber instruction. Some parents are being handed waiver agreements where they're agreeing not to ask for compensatory education or compensatory services during the time that their child is fully online because they can't access the in-person instruction. So do not sign those waiver agreements. But the types of changes to the IEP that you may want to consider during the pandemic may include counseling services. A PCA or a one-on-one aid, are in-home services required? The Department of Education has issued guidance. If the IEP team thinks it's no longer appropriate to have a one-on-one aid because the student's needs have changed, then the IEP could be revised. That is something, I have some tips relating to that. You want to fight that determination and don't agree that the child no longer needs a PCA because of this temporary situation where they're at home on online instruction. First of all, you want to ensure that that is correct. And secondly, they should remove a PCA from the IEP because the IEP is related to the services in the school building. Remember, this pandemic is a temporary situation. If that PCA is removed from your child's IEP, you're going to have a delay in getting those services back in. If the district resumes all in-person instruction. Okay, if your child needs a PCA in order to follow some of the safety or hygiene protocols or, access their instruction, it is something that you should discuss with the school district. The PA Department of Education said that if in-home supports cannot be provided, then consider compensatory services determination for lack of having this instruction. So even the Department of Education is indicating that these services should not be automatically removed from the IEP just because your child is on online instruction. But considering the CCS determination, I have some tips around that. And one of the things that I mentioned before is to discuss with the school district, well, looks like you're going to owe me compensatory services. Why don't you just pay for someone now to come to my home and help my child access their instruction? And that's, a discussion that you can have with the school district as an alternative. Okay, how can you qualify for 4 days of in-person instruction? Largely it's going to depend on your child's needs and whether they're able to access the online instruction. So that journal of difficulties, again, is going to be important. Get medical documentation from your doctor if necessary. So if your child is extremely inattentive, or they have a visual disability or a disability that prevents them from accessing online instruction or looking on online instruction the entire day, or any other need, just get a handle on why your child, because of their disability, cannot access the online instruction and is not benefiting from the instruction being provided. As I said, medical documentation is helpful. The journal of difficulties is going to be helpful. Make sure you've emailed the teacher as well of some of these problems. Document your child's performance. Gather any information as to why your child is not benefiting or accessing the online instruction. Print out your child's assignments. If they're handing in assignments that really don't look like they're what your child, could normally produce if they had in-person instruction, those are things, print them out, keep them in a file, take them to the IEP meeting when you request in-person instruction. As I said before, unless your county is in a substantial incidence county, then the choice to deliver online instruction is optional. It's optional. Your school has the option of delivering 4 days of in-person instruction if they're moderate, 5 days if they're in the low incidence. The fact that they're choosing to deliver online instruction is a choice. That doesn't prevent your child from going into the building to access services that they need in order to make progress. So, please keep that in mind as you're discussing it with the district. Can you get a PCA or a one-on-one at home? This is one of the most difficult things it's one of the most difficult services really to get. The first thing you want to do is try to prevent the revision to the IEP. So as I said before, if the IEP, if the district feels that your child's needs have changed and that they don't need a PCA, it shouldn't be based on the fact that they're receiving online instruction. That is a temporary situation because of exigent circumstances. We have a pandemic. So that should not be the reason as to why your child is no longer getting a PCA in the IEP. What the guidance says is that if your child's needs have changed. So document the needs, your child's needs, get medical documentation, document your child's needs during online instruction. If you have a wraparound person coming to the house, a service provider who's helping your child with some behavioral issues or some emotional needs, have that person write a letter as well. Again, these are all measures to try to prevent that service from being taken off of the IEP. If the school district nevertheless decides to remove that service from your child's IEP and they give you a NORAP, you reject that NORAP within 10 days, you ask for mediation or due process, that service has to continue while the mediation or due process is being resolved. So you do have some protections under the law. You have the ability to keep some of these services, and I would suggest you do that if your child truly needs a one-on-one. Consider less restrictive measures for getting the services for your child. If your child is able to go into in-person instruction, even in a very limited time frame or designated areas, try to do that for your child. Again, it's a least restrictive measure considerations. If your child is able to do that, again, this is a highly individualized consideration. If they're able to do that with some adjustments to their program, then that is ideal. And again, if the PCA is in your child's IEP and they're in the school building, they should get the PCA. You can, as I said before, request compensatory services from the district, but not later when they decide or have that meeting and 3 months down the road they have a meeting with you and they say, oh, well, we never provided you that PCA, even though you've repeatedly told us in emails that they needed help. So now we can give you services. Try to negotiate in a proactive manner. Say, look, my child needs a PCA. Their needs haven't changed. Their educational circumstances are different, but they still need the service and they especially need it during online instruction. So perhaps you can negotiate the compensatory services now rather than being considered later. And it may save the district some compensatory services as well, because if your child is not accessing their education, not only are they not getting the PCA, they're not benefiting from their instruction. So it may be, worth it to them to think about that. Transition services, the OVR processing has slowed down, but they're still doing it. These should be continued to be provided. I'm going to pause a little bit for a couple of quick questions. Jessica, if you can pick just a couple of them, because I know, the PCA was a question for some of the parents.
Absolutely. The first quick question that we got submitted during your last portion was that we have had a few parents who have expressed that their teachers have repeatedly asked them to provide the role of a PCA and one-to-one assistance instruction while in virtual learning. What is an appropriate response to these teachers to these numerous requests to fulfill that role?
Okay, so if I understood the question, the districts are asking the parent what the PCA is going to do in the child's home.
No, sorry, I apologize. The districts have asked a few parents to be the one-to-one, to look over correcting the work assignments, to make sure that work has been submitted, to make sure that they're accessing their education, and what is an appropriate response for these parents on telling the district that this is not a role that they can fulfill.
Okay, so I just want to draw a slight distinction. A PCA is if your child had a PCA in the IEP, that's a classroom assistant who helps them attend, whatever it is the child needs to do in order to benefit from their education in the school district. But that's something that should appear in the child's IEP. If they have a PCA, it's in the IEP. So I just wanted to draw a distinction because many parents whose children do not have a PCA in the IEP are performing those very duties for their children at home during the online instruction. But if your child has a PCA in the IEP and the parent is finding themselves performing these duties, and the school district wants to know, and I'm sorry, I'm missing the questions. The district wants the parent to identify what they're doing as the PCA?
No, the parent is asking what is the appropriate response to the district that they cannot be completing the work for their child or always consistently checking it or creating a schedule for them.
Okay, so if your child had a PCA in the IEP, then the reason that the parents need that assistance is because the school district has already determined that in order for the child to benefit from the instruction is through the use of an aid. The aides are trained by the Department of Education. They have to have certain hours of training. They have to be trained specifically to address the child's needs in the environmental setting. The district is not training parents. I've not heard from any parent that they have to have been invited to or engaged in any training sessions for PCA or aid training. So there's a distinction between a parent fulfilling the role as a supportive parent for their child during the instruction and when the child needs a PCA that was in the IEP. And remember, the district has already determined that the child needs a PCA. So, asking the parent to justify why they can't fulfill the role of a PCA when the district has already determined that the child needs a PCA, it's inappropriate. The parents are not trained to provide that level of assistance, and there should be a behavior plan also associated with fulfilling that role, behavioral techniques and measures that the PCA is specifically trained to implement for the student. So that would be my response.
Thank you. And then one more on the one-to-one and PCAs. If your child has 6 hours of one-to-one PCA in an IEP, but is currently only getting 30 minutes with the PCA with remote school, and the district said that they do not have enough staff with parental requests to give more support, what are the next options? We have seen that question come through twice on a school district's response for not enough staff at this time.
Right. So if there's not enough staff, then what I would suggest is you're looking at a situation where you may have compensatory education or compensatory services owed at some point in the future. I would approach the district and say, look, this is either a compensatory education or compensatory services issue. Let's address it now. Pay for someone. I will find the person or the PCA, if it's something, depending on the child's needs and whether there's a behavior plan. But pay for someone to come to the house, even if you don't have the staff. Not having sufficient staff has never been accepted under the IDEA as a legitimate reason for not providing services to a student. I'm not recommending to any parent to get into that discussion at this point. If the district does not have the services or the resources or the personnel, really, I should say, to provide the services, then the parent should talk to the district about their paying for services that the parent can find to bring in. Those services, of course, need to be reasonable. You know, they can't charge an outrageous rate, but it's a conversation I think would behoove parents to have with the districts.
Thank you.
Okay, so, okay. Transition services, there may be some limitations in community placements. The delivery of the transition services may have to be increased if the community placement is not offering services. So what that means is, you know, if your child is supposed to go to a community placement 2 days a week to get on the job training, and that's not delivered, then the school district still has to fill in that time. You know, they can't just say, well, you don't get services for 2 days a week because the place, your job site, is not accepting volunteers right now, or interns, or, you know, or placements. If the district is taking the position that these services are not going to be delivered because, you know, that the job location is not cooperating due to the pandemic, then consider compensatory services as well, the CCS. Okay, transportation is required still to and from school. If you're getting compensatory services, the Department of Education is suggesting that the district provide transportation, but they're not requiring the district to provide transportation of the student to the school in order for them to access the compensatory services. So this would apply to situations where the compensatory services are being delivered after school, or, you know, or before school, depending on the circumstances. So while transportation is required for in-person instruction during the regular school day, if compensatory services are being delivered after school or sometime outside of the school day, PDE is advising or suggesting that transportation be provided, but not requiring it. Students in charter schools, the districts are required. So with charter schools, the districts provide transportation for students in the charter school. If the charter school is open and offering in-person instruction at any level, hybrid or, you know, full, but the school district is only offering online services, virtual services for now, the district is still required to transport the charter school students for their instruction. Okay, the NORAP can be signed digitally, can be signed online. They're not requiring parents to, you know, handwrite a NORAP and hand it into the district. All other requirements regarding the NORAPs have not been changed. So you still are entitled to receive notice before significant changes. You can still reject them. If you ask for mediation or due process within 10 days, you're entitled to continue to receive those services during the outcome of that complaint. If you receive a NORAP, if there are changes to your child's, if you're not sure whether you agree with the changes, or you can still check off that you agree and disagree, and you can state that, you know, this is alternative language that I'm providing. If services are being eliminated, and you know they're necessary, like PCA or one-on-one, or speech and language services, for instance, just because the district can't deliver the services online. If there are any necessary services that are being eliminated, you check off the disagree box. You say you don't agree. I have the language here for you in the box. And then you ask for mediation or due process within 10 days. You get that form right back to the district, and you send it over to the Office for Dispute Resolution as well. And you get to keep those services until the outcome of, until that dispute is resolved. So it's very important, especially in situations like a PCA or other services that you know your child is entitled to and absolutely needs during in-person instruction, and the district is trying to remove them from the IEP. Compensatory services. Okay. The Department of Education has provided specific guidance and steps, a procedure to follow in terms of to determine whether your child is entitled to compensatory services. The school district is required to hold an IEP meeting to examine if and to what extent, and these are important words that they're using here, if and to what extent compensatory services are owed to your child. So, the fact that your child didn't receive online instruction or had difficulty with technology or really isn't benefiting to the full extent of their program are maybe forgivable, in terms of compensatory services. So, what the Department of Education is instructing that you look at is if and to what extent these services are owed to your child. And this determination is made by everyone, including the parents. So you look at whether compensatory services are needed to remedy the student's skill, behavior loss, and or lack of progress that resulted because of the pandemic, essentially. So, so it's not a question of whether they missed out on services, is whether these compensatory services are needed to remedy that loss. They look for these services, the amount of these services are considered after a recoupment period, which the Department of Education has said can be up to 3 months after any instruction has resumed. So either in-person or hybrid instruction. Choosing to do 100% online, virtual, or are in a hybrid model by choice, then that period begins, that 3-month period started on the first day of school, whether it's online or in person. So the compensatory services are considered after a recoupment period, 3 months after instruction began. Okay, so this is the process, and it's going to flow a little bit like a flow chart. Okay, so online instruction has begun again in the fall. You implement that IEP as soon as in-person instruction begins. The district is supposed to gather baselines as soon as possible in order to determine the present educational levels during the first weeks of instruction. So that's something that is very important. During the first weeks of instruction, the district is to gather baseline data. That is your data as to where your child's skills and abilities are, from the first day of school after the pandemic. Then you compare that baseline data to the 2019 school year progress monitoring data to see if there's any regression. So if there is, so if your child has regressed and then you continue forward through the process. If there is no regression whatsoever and your child's levels are exactly the same, then you don't get compensatory services. The compensatory services are designed to address regression, and after regression, a long term of recoupment or delay in recoupment of those skills. So if there's no regression, according to the Pennsylvania Department of Education guidance, then you're not entitled to compensatory services. So the question becomes, what are we looking at to determine whether there was any regression? And I have a couple of practice tips here for the parents, but the regression, if there was regression, then during any time within the first 3 months of school where instruction has started, the IEP team has to review the progress of the student using multiple data sources. So now they're looking to see whether the student, after they've regressed, can recoup some of these skills that they've lost during the school closures as a result of the pandemic. So regression alone doesn't get you there. They have to see whether you can recoup those skills within the first 3 months of school. There's a priority to students who have the greatest difficulty accessing free and appropriate education in the remote learning environment or who aged out during the 2019-2020 school year. So in terms of, what IEP meetings are supposed to occur first, they're the ones for students who've had the greatest difficulty accessing online instruction and those who have aged out. Those are the ones that should have this meeting first, the compensatory services. With that data, Then the IEP team determines whether the student has recouped the lost skills. So after no more than 3 months of data gathering, then the team is going to look at the data that they gathered and compare where the student skills are after the 3-month period to where the student skills were before the school closures. If they're at the same level, that means the student has recouped their skills and there are no compensatory services. If the student's levels are still below, then you would have access to compensatory services. But the IEP team then determines whether and to what extent the child needs compensatory services in order to make up for that loss. So even if you pass all of these hurdles and you can show that the child still hasn't recouped all of their skills, then the IEP team gets together to determine whether and to what extent the child needs compensatory services. So on the first glance, it looks like it, could be a difficult road here to get compensatory services, but I do have some suggestions and some tips for parents. Okay, so the data that they're comparing are data collected through the extended school closures during any period where the child didn't receive services. So during the time period, let me kind of move down to the next bullet because it'll be easier to explain. What should be happening is that you compare the child's levels on March 13th, which is the last day of school before the closures, with the baseline data that is taken within the first 3 weeks of school to determine whether there's regression, and afterwards during the first 3 months of school to determine whether your child has been able to recoup. Now, the information according to the Department of Education, the type of information you want to gather are the levels of academic and functional performance, including the level of performance towards their IEP goals. Information and observation from teachers, they're all listed here. The student's ability to access the remote learning and the special education services provided during that time frame. Students' engagement during that process, the amount of skill or behavior loss. So some of these questions really could be answered if you have a journal of difficulties that you've been keeping. If you haven't been keeping one, start keeping it now because that could impact the compensatory services, and you'll have some nice data to discuss with the IEP team. Any historical data about your child's ability to recoup lost skills. If your child had ESY before, because your child generally has difficulty with regression or recoupment, that is an important piece of information because the 6-month extended closures that we've had would necessarily impact your child, and your child should have recoupment and regression issues if they've in the past received ESY services for just the summer closures. So that's something to keep in mind. Okay, any results from formal and or informal assessments? Okay, to determine if your child is determined to need compensatory services, then the IEP team discusses the type, amount of services, and how it will be delivered. The services should not be provided in place of current services. So if your child needs compensatory speech and language services and they have speech and language as part of their IEP, the compensatory services should not be occurring during the same time frame that your child's supposed to receive services now. So keep an eye on that because they're not supposed to supplant or replace your child's IEP services. They're supposed to be provided in addition to. Okay, so here are my tips. Get that journal of difficulties started. If you've already started one during the summer or last spring, just keep it up, keep writing your notes, keep emailing the teacher any difficulties that your child has had. Print all of the online work submitted. I had one student who looked like they were engaged in the process, that every time the parent came in to make sure that they were online, doing their online learning, the child was just typing and saying, yes, I'm participating. But if you looked at his work, he was just typing JK for his math problems. He typed in 1, 2, 3, 4, 5, 6, 7, 8, 9. The parent thought they were engaged, but when you really look at the work that he submitted, he clearly wasn't. His child with ADD. So that would be beautiful information to provide to the school district and say, look, he wasn't accessing the information. He needed more help. Again, if your child received ESY previously, that's a really nice piece of information. For regression, if your school district did not collect that baseline data within the first 3 weeks of school, you may be entitled to some compensatory services. It's not something that the Pennsylvania Department of Education has said. It's something that I am saying, but that is a nice piece of evidence. You cannot tell me that my child did not regress if, or I should say my client did not regress, if you're not even taking the baseline data within the first 3 weeks of school. How can you possibly make that determination? The recoupment time also is another area that parents should keep in mind. Because of the course of the school year and when we get progress monitoring, typically progress monitoring is provided January, kind of, that second marking period time, the end of January. And then the next end of marking period is typically in April, sometime in April. The school's closed in between, in mid-March. So what school districts may be doing is looking at the January progress monitoring report rather than looking at the most current information that they had as of March 13th. What you want to do is ask the school district to provide all the data that they were collecting between January and March 13th, even though, that was before the report card reporting period. Because what you want to avoid is comparing your child's current levels to those of January, because your child may have made some additional progress between January and March. And now you're comparing, lesser skills with the time frame. You don't want to compare it to the January time frame. So to the extent you can get the teacher's notes, teacher's records in terms of where your child's educational levels were or their progress towards their goals, get it as close to March 13th as possible. You don't want to rely on that January progress monitoring report. There are some disabilities that are presumptively more likely to qualify for ESY, meaning regression and recoupment. I would argue that these disabilities are the same ones that should be presumptively able to, be eligible for compensatory services. And those would be, those are listed here: autism, pervasive developmental disorder, intellectual disability, serious emotional disturbance, okay, and I just explained this in terms of, when you want to compare the skills. All right, when can the compensatory services be provided? Before or after school, during a free period. They shouldn't replace instructional time. If the school district is replacing instructional time with the compensatory services, that's not okay unless you're okay with it. But that's something you should keep an eye on. Are you owed services or hours? That's unclear. The Pennsylvania Department of Education hasn't issued any guidance that I've seen that indicates it's only services or, and not hours. So if your child cannot receive the services during the day, then I would consider discussing with the school district getting hours so that you can then hire someone and use those compensatory education hours in order to make up for those services. Okay, if your child is determined not to qualify for compensatory services for any reason, there was no regression. There was regression, but they recouped and they're doing wonderfully. For any reason at all, the school district tells you, or they find that there is regression, there are problems with recoupment, but they're not necessary in order to, to bring your child up to speed. Don't completely give up. You still may have access to compensatory education. And so what the difference is that the compensatory services is for a lack of implementation of the IEP. There are services that are intended to compensate for the lack of implementation to the IEP that they didn't receive. Compensatory education are hours that your child can access if their IEP is inappropriate. So if, if you get through the first 3 months and you go to your IEP meeting to discuss compensatory services and the school district is telling you, sorry, we don't think you qualify, you can still challenge that determination. You can file complaint with PDE. You can file, ask for mediation, and you can file a due process complaint based on that determination alone. But even if you lose that aspect of it, you can still file for due process for compensatory education. There's no assumption that the underlying IEP as a whole is appropriate. So, don't be overly discouraged if you think your child is behind and you disagree with that determination. Consider filing a complaint for compensatory services and compensatory education. You can hit both of them, but all is not lost. Don't give up. Okay, so and the last couple of slides I have here are more precise information about what you may want to include in your journal of difficulties. Again, these are all suggestions that I have, and I've also provided for you the Pennsylvania law regarding the 7 factors for considering extended school year services. These are similar to the factors that the Pennsylvania Department of Education has provided in terms of what's being considered, what kind of information is being considered. So take a look at the ESY, look at the Pennsylvania guidance from the previous slide, and you can just compare them. And hopefully that'll give you enough information to be able to prepare for that IEP meeting. So you have all of the information you need in order to discuss this with the IEP team. Okay, waiver agreements. We'll go quickly through this. If the school offers in-person instruction, this is where I'm seeing this mostly. If the school offers in-person instruction and the student cannot go into the school building for whatever reason in relation to their disability or their needs or health condition, some school districts are telling parents, that's fine, you don't have to bring them in. You can do online, do virtual, but I want you to sign a waiver agreement. And what the waiver agreement essentially says is that the parents are waiving all rights to specially designed instruction, related services, program modifications, appropriate services, supplementary aids and services during the time of online instruction. If the school district provides any of this instruction, great, or services, but you cannot sue them if you think that they're inappropriate, or if your child doesn't benefit from them, or if there's some regression, or if the underlying IEP is inappropriate. These waiver agreements are very broad. It's inappropriate for the school district to provide this to the parent without even engaging in a discussion about alternative methods, least restrictive methods to provide services to the student that they're required to engage in. So if you see any of these, please do not sign them. Talk to an attorney, review it. You should not be in a position where you're deciding between your child's rights and their access to education. It's ridiculous. Don't sign them. Talk to somebody. You can call me, you can talk to me. I feel very strongly about this, and I think it's an unfair thing to position and put the parents in. Okay. If your child has a medical need, I would, talk to the doctor. Okay. Due process and mediation are still going on. They're still ongoing. There are some circumstances where, virtual hearings can be delayed because of the pandemic. If the school building is not having people come in, or the governor has indicated that, you can't have more than a certain number of people in a room, or you cannot accommodate that 6 feet guidelines. These due process can be done virtually. And extensions of the time frame in which to receive a decision can be agreed upon by the parties. But these due process complaints are moving forward, largely virtual. That's what's been happening pretty much all summer and in the fall. Okay, this is my last slide. After this, we can go into the question and answer session. I apologize for running over time. I think we're about a half hour over, but there's a lot of information to be provided, and I wanted to get those tips to you because they're so important. I give free consultations and reviews of IEPs and evaluations if anyone has any questions. And, you know, as mentioned before, I'm fluent in Spanish. I do, you know, a large part of my work is working with the Spanish speaking Latino community. I've, you know, been practicing for many, many years, almost 30 years as an attorney, but the last 16 specifically with families, children who have special needs. This is an area for me that I'm very passionate about. And I, you know, I'm here to help.